So part two of a head-to-toe nursing assessment as an NP. You might need to know these things. They're worth knowing at BSN level as well. You got your cranial nerves. They got easier ways to go over this, but like there's like you can draw stuff, but it's good to kind of see what they actually look like. So this is a pretty good replica. Um, So when you are assessing a jaw and whether it opens or closes, this is cranial nerve 5 right there. It's called the trigeminal nerve. Let me see it. Let me try to find the jaw muscles. Because you got cranial nerve 7 that kind of goes over the face. Try to locate that. But yeah, when you open your jaw and all that stuff, it's part of your trigeminal nerve. So you got your cranial nerve 5 is right there. That's your trigeminal nerve. It also is responsible for opening and closing your jaw against resistance. So you can kind of go in through it, and then when you kind of poke somebody's face while you're assessing them, that you kind of assess for symmetry. That's kind of making sure that the sensory part of cranial nerve 5 is intact. Cranial nerve 7, which is the facial nerve right there. So you can see cranial nerve 7. This you kind of test. You have them kind of puff their cheeks, blowing them out like a blowfish, basically. Smile, frown, puff your cheeks, pucker your lips. You're testing cranial nerve 7 right there. So that's kind of like the face part of it, right? So then you go to the after you test the facial nerves, right? Trigeminal, cranial nerve 5, and facial, cranial nerve 7. You go through, you kind of assess the eyes. So you'll kind of shine a light in somebody's eyes. You'll make sure the eyes kind of constrict and close. Make sure they're perla. As you can see here, this is cranial nerve, I believe, 2. Cranial nerve 5, you got the maxillary somewhere around here. Cranial nerve 2 helps you see. Let's see. It's kind of hard to see, but you got cranial nerve 2, right, which is kind of like where your eyes help you see. And then you got what else? I'll talk about the optic nerve later, but let me cut out the eye real quick. See if I can get cranial nerve 2 somewhere. Cranial nerve 3. Cranial nerve 3 is kind of when you look down. So this is cranial nerve 3 right there. Cranial nerve 5. You got this whole network of nerves, but as you can see, this is cranial nerve 3, ocular motor. The abducens is like cranial nerve 6, so somewhere in there, it's like it kind of has the muscles that kind of help you look inwards. So when you want to test cranial nerves 3, 4, and 6, you'll kind of like up, down, kind of like an H pattern. So that's like cranial nerve 6, 3, 4, and 6. That's going to be the oculomotor, the trochlear, and then the abducens. When you're testing the cranial nerves that kind of move the eye muscles in there. Let me see if I can kind of go inside. Yeah, I can't really see it, but that's kind of like those nerves are kind of like the eye muscles. So cranial nerve 2 right there. We got the optic nerve inside the eye in that little network. Cranial nerve 5, part of your big old trigeminal, right? Cranial nerve 3, oculomotor. So this is kind of like, if you look through, it's kind of providing a nerve supply to this muscle right here. And then you kind of look around, little eye sockets right there somewhere. I might be able to find cranial nerve 6 somewhere in there, but let's see. Man. Nah, but it's a little tough, but cranial nerve 6 is somewhere inside there. But it's not necessary for the skills lab, it's just for your knowledge. Boom, 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 you're testing cranial nerve 3, 4, and 6 by doing that, right? That's going to be the oculomotor, the trochlear, and the abducens. So that's the eyes. Cranial nerve 2, or cranial nerve 1 is the nose, but we're not worried about that part. The idea is you're kind of looking through the nose, making sure the nasal septum's intact. So that's kind of like the nose. Oh yeah, and you kind of want to make sure like the eyes are, perla, blood vessels and whatnot. Next you got the, so next thing you know, you're going to be looking at somebody's mouth, right? For like, make sure their teeth are intact, make sure there's, everything is good. When you look at a patient, it's going to be pink and moist. So you just delete all the teeth right there. Just try to get to these cranial nerves. So once we cut out the tongue and cut out, I know this would be gruesome on a real person, but let's delete the jaw so we can get these cranial nerves right there. So yeah, we cut all that stuff away. Cranial nerve 5, you can see it's cranial nerve 5 covers a lot of stuff, but you got cranial nerve 12. This is your hypoglossal. It kind of helps you like stick your tongue out, move it side to side. As you can see, this little, this is your uvula. Every time you speak, cranial nerve 10 causes this uvula to move. So yeah, you got the cranial nerve. Alright. So you got cranial nerve 5 everywhere, right? But cranial nerve 12 is the, like I said, this cranial nerve 12 right there. And then cranial nerve 9 on the carotid branch. Cranial nerve 9 activates when you have the gag reflex. Cranial nerve 10, this is the cranial nerve 10 right there. Let's see if I can cut away some more of these non-nerve components, like the roof of the mouth. So you got cranial nerve 10, 12, cranial 10, cranial nerve 12, it kind of controls the tongue and pushes it out side to side. And then lastly, so that concludes the head, and then we'll talk about cranial nerve 11 right there. So that's cranial nerve 11. You got cranial nerve 7, which is your facial vagus nerve, right? Cranial nerve, cranial nerve 10 is your vagus nerve, so that kind of, that's kind of like with that whole swallowing reflex. Cranial nerve 11 is how you shrug. So yeah, that's that would basically be the things you're kind of looking for. That'll be like the hardest part of an advanced health assessment as a nurse practitioner student. But they're worth knowing as a BSN student. I think as an LVN, it's probably unnecessary information, but yeah. Deleted his face, man. That's kind of like the uncanny valley. But yeah, cranial nerves, man. It's try to teach this to some LVN students, and they're not going to know what to do with this, man. But yeah, I mean, it becomes important in RN school, but you don't really need to know all these things until NP school. But hey, it's pretty good stuff. I had this program since I was in BSN school, and it's still doing me well in NP school as well. So that's the cranial nerves and the lymph nodes.